Preventing constipation is one thing. In fact, you probably already have a good idea on how to keep constipation from occurring. But what about actual relief? What can you do to get relief from constipation right now? Well, you're at the right place, as that's what we are going to be talking about today. Welcome to your wellness journal and to our video on 5 tips to help relieve constipation right now. Today, we will discuss 5 easy to follow nurse recommended tips for almost immediate constipation relief. Ooh, and pay attention to tip number 5, as I am almost certain it's not something you've heard of before. If it is, let us know in the comment section below. And if you don't want to keep suffering from constipation, watch through to the end of the video, as we'll also list some quick tips for that. We'll also touch on when you should contact your doctor, as well as some of the more common medical interventions for the condition, in the rare instance that the tips we give you today fail to work. Let's jump in and start with something easy. Constipation tip number 1, drink warm liquids. Alright, let's talk about one of the simplest and most effective ways to get things moving when you're constipated: drinking warm liquids. Now, why does this work? Well, warm liquids help in a few important ways. Firstly, they stimulate your digestive system. The warmth causes your intestines to contract gently, which helps push waste through. Number 2, warm liquids help soften your stool. When you're constipated, your stool can become hard and dry. The extra fluid from warm drinks adds moisture, making it easier to pass. Number 3, they keep you hydrated. Dehydration is a common cause of constipation, so any extra fluids are helpful. Some good options to try are warm water with lemon. The warmth stimulates digestion and the lemon adds a little extra boost. Herbal teas. Things like peppermint or ginger tea can be soothing for your stomach. Clear warm soups or broths. These provide both warmth and hydration. Here's what I recommend. Start your day with a cup of warm water or herbal tea before you eat anything. Then, try to include warm liquids throughout your day. Coffee may also help, but it is important to remember that although some people may experience increased bowel activity after drinking coffee, others may not. So, give coffee a try, but do it cautiously. Overall, aim for about 8 cups of fluids total, with several of those being warm options. Remember, the key is to be consistent. Don't expect miracles after just 1 cup. Give your body time to respond to this new routine. Do you have any questions about this? Let us know in the comment section below. Now, let's talk about constipation tip number 2, and it's walking and getting regular exercise overall. This is a really important one, and I am glad we are discussing it. Walking and regular exercise can be incredibly helpful for relieving constipation, and here's the reason why. Firstly, movement stimulates your digestive system. When you walk or exercise, it helps get things moving in your intestines. The physical activity stimulates natural contractions of your intestinal muscles, which helps move stool through your colon more efficiently. Improved blood flow. Exercise increases blood flow to all parts of the body, including your digestive system. This improved circulation can help your intestines work better. Number 3, stress reduction. Regular exercise is great for reducing stress, which can be a factor in constipation for some people. Now, you don't need to run a marathon to see the benefits. Even a 10 to 15 minute walk after meals can be helpful. Aim for about 30 minutes of moderate exercise most days of the week. This could be brisk walking, swimming, cycling, or any activity you enjoy that gets you moving. If you're not used to exercising, start slowly. Maybe begin with a 5 to 10 minute walk after dinner and gradually increase the time. Listen to your body and don't overdo it. For those who have mobility issues, activity can come in the form of bed exercises and upper body movements. Consistency is key here. It's better to do a little bit every day than to do a long session once a week. Also, try to time your exercise about an hour after eating. This gives your body time to start digesting your food, and then the exercise can help stimulate your bowels even more. Next up on the constipation tip countdown is number 3, eat prunes. You can also drink prune juice, and you can benefit from increasing your overall intake of fiber in addition to these plums. This is a really effective strategy that I often recommend to my patients. Prunes, which again are just dried plums, are nature's little helpers when it comes to constipation. Here's why they work so well. First of all, they are high in fiber. Just a cup of prunes gives you about 6 grams of fiber, which is nearly a quarter of your daily needs. 2. They contain sorbitol, a natural sugar that acts as a laxative by drawing water into your intestines. 3. Prunes have certain compounds that can stimulate movement in your digestive tract. Now, you don't need to eat a whole bag of prunes. Start with just 4 to 5 prunes a day and see how your body responds. You can eat them as is, or if you prefer, you can drink prune juice. About 4 to 5 ounces of prune juice can be very effective. As for increasing your overall fiber intake, aim for about 25 to 30 grams of fiber per day. Good sources include whole grains like oatmeal, brown sugar, and whole wheat bread. Vegetables, especially leafy greens, broccoli, and carrots. Fruits with a skin on like apples and pears. Beans and lentils, and nuts and seeds are also good options. Remember, when you increase your fiber intake, do it gradually. A sudden increase can cause bloating and gas. Also, make sure you're drinking plenty of water. Fiber works best when you're well hydrated. Do you have any questions about adding prunes or more fiber to your diet? Is there anything you'd like me to explain further? Let me know in the comment section below. Oh, and if you haven't done so yet, please don't forget to like this video and consider subscribing to our channel for more content on health and wellness from a channel run by nurses. Next constipation tip is number 4. Take a warm bath. This is a simple but effective method that many of my patients find helpful. Here's why a warm bath can help with constipation. Number 1, it offers relaxation. A warm bath helps you relax your entire body, including the muscles in your abdomen and around your anus. When these muscles relax, it can make it easier for stool to pass. 2. It improves blood flow. The warmth increases blood circulation throughout your body, including your digestive system. This can help stimulate bowel movements. 3. Stress relief. Constipation can sometimes be linked to stress. A warm bath can help reduce stress levels, which may indirectly help with constipation. How to use this method. Fill your bathtub with comfortably warm water, not too hot as that could be dangerous. Soak for about 15 to 20 minutes. Try to relax and take deep breaths while in the bath. You might want to try this before bedtime as it can help you relax for sleep too. For some extra relief, you could try adding Epsom salts to your bath. These contain magnesium, which can help relax your muscles even more. Remember, while you're in the bath, make sure to stay hydrated by drinking some water. Dehydration can worsen constipation. If you feel the urge to have a bowel movement during or shortly after your bath, don't ignore it. That's your body's natural response, and it's best to listen to it. Do you have a bathtub at home you can use for this? If not, even a warm shower might help, although it might not be as effective as a bath where you can soak. Next up, tip number 5 for constipation is not something you might have thought about. Using a footstool when you're on the toilet. Surprisingly, it's a simple but effective way to help with constipation. Here's why it works. When you sit on a regular toilet, your body isn't in the ideal position for having a bowel movement. Our bodies are actually designed to squat when we go to the bathroom. Using a footstool helps mimic that natural squatting position. Here's how to do it. Get a small footstool that's about 7 to 9 inches high. You can buy a special toilet stool like Squatty Potty, or just use any sturdy footstool you have at home. Then, place the stool in front of your toilet. When you sit down, put your feet up on the stool. This raises your knees above your hips. Lean forward slightly, resting your elbows on your knees if that's comfortable. This position does a few important things. It straightens out your colon, which makes it easier for stool to pass. It relaxes the muscle that usually keeps stool in, so you don't have to strain as much. And and it can help you empty your bowels more completely. If you need assistance with this new toilet position, don't be afraid to ask someone in your household. If you have mobility issues, talk to your doctor first before using a footstool on the toilet. Now, I want you to know that while many people find this helpful, it might not work for everyone. It's really about finding what works best for you. If you do decide to try this, give it some time. It might feel a bit strange at first, but many people get used to it quickly. And remember, it's just one tool in managing constipation. You have a lot more available to you. Now, moving on to how to prevent constipation. In addition to the 5 constipation relief tips we discussed, which you can also turn into constipation preventing habits, I have 3 more that you can do on a regular basis to help ensure you don't get constipated anymore. Starting with, increase your overall fiber intake. We already discussed the many benefits of prunes and prune juice. Now let's talk about fiber in general. It's like nature's broom for your digestive system. Try adding some yummy fruits like oranges or apples to your diet. Vegetables, whole grains, and beans are great too. But here's a little secret. Increase your fiber intake gradually. We don't want to shock your system and end up feeling bloated. Next tip, establish a regular toilet routine. Get your body used to going to the toilet at more or less the same time every day. Figure out what works for you. It can be right after breakfast or when you're getting ready in the morning right before your shower. It can also be part of your bedtime routine. This next one is related to this, and it's don't ignore the urge to go number 2. When you feel the need to have a bowel movement, don't delay. Holding it in can lead to harder stools that are more difficult to pass. In addition to these 3, I suggest going over your medications with your doctor or medical health provider to find out if you are taking any medications that are making you constipated. Constipation is a common concern that affects a lot of people. It will happen to you whether you like it or not for whatever reason at one point or another in your life. In most cases, the condition will go away on its own, especially if you do the tips we discussed. Everyone's body is different, and anywhere from 3 times a day to 3 times a week can be normal. What's important is what's normal for you. That being said, if you're feeling uncomfortable or noticing changes, here are some signs that it might be time to give your doctor a call. 1. If it's been more than a week since your last bowel movement, we don't want you feeling miserable for that long. 2. If you're having severe abdominal pain or bloating, constipation shouldn't be painful, so this could be a sign that something else is going on. 3. If you notice any blood in your stool or when you wipe, this isn't necessarily something to panic about, but it's definitely worth getting checked out. 4. If you're losing weight without trying, this could be a sign of an underlying issue that needs attention. 5. If your constipation is accompanied by fever or vomiting, these symptoms suggest there might be an infection or other problem that needs treatment. 6. If you've been constipated for 3 weeks or more, even with lifestyle changes like drinking more water or eating more fiber. At this point, we'd call it chronic constipation, and your doctor can help find the cause and the right treatment. Remember, there's no need to be embarrassed. We're here to help you feel your best, and that includes having comfortable, regular bowel movements. If you're ever unsure or worried, it's always better to check with your doctor. We'd much rather see you and reassure you than rather have you worrying at home. Now, let's touch on the different medical treatments we have for constipation. I know it's not the most comfortable topic, but I'm here to help you understand your options. First, we have over-the-counter treatments. These are things you can buy at the pharmacy without a prescription. They include fiber supplements. These are like adding extra fiber to your diet. They help bulk up your stool and make it easier to pass. Then there are the laxatives. They can be osmotic laxatives, stimulant laxatives, or lubricant laxatives. You can also get stool softeners. And if it comes down to it, you can also use enemas and suppositories. If these over-the-counter drugs aren't helping, your doctor might prescribe stronger medicine. Remember, we always start with the gentler options first. We'll get you to try lifestyle changes like eating more fiber, drinking more water, and getting more exercise. If those don't work, then we'll move on to over-the-counter treatments. Prescription medicines are also a last resort for stubborn constipation. Alright, let's wrap this up. Remember, dealing with constipation isn't always easy, but you've got these 5 simple tips in your toolkit now. Whether it's drinking more water, eating more fiber-rich foods, getting some exercise, trying a warm bath, or using a footstool, there's bound to be something here that helps you feel better. Don't get discouraged if you don't see results right away. Our bodies sometimes need a little time to adjust. And remember, you're not alone in this. Constipation is something many of us deal with from time to time. If these tips don't seem to be helping after a few days, or if you're feeling uncomfortable or worried, don't hesitate to reach out to your doctor or nurse. We are here to help you feel your best, and that includes having comfortable, regular bowel movements. Your Wellness Journal is a channel run by nurses. Our goal is to provide you with correct and helpful information. If there is a topic you'd like us to discuss, leave us a comment in the comment section below. We are your Wellness Journal. Have a healthy day.